Dr. Murphy presents questions and answers about the Brazilian butt lift.
Hi, I'm Dr. Terry Murphy. I am a board-certified plastic surgeon, and I am Chief of Plastic Surgery here at Swedish Medical Center. Today I want to talk about body contouring, and in particular, a specific body contouring procedure which has become commonly known as the Brazilian butt lift. In my practice, I have a broad experience in body contouring procedures, probably performed easily thousands of combined things like liposuction, tummy tucks, butt lifts, and arm reductions. But today we're going to focus on the rear end and the kind of procedures that I do on patients who want to improve the appearance of their buttock area.
Who are the candidates for a Brazilian butt lift?
In general, plastic surgeons have seen an increased demand from patients who want to improve the appearance of the buttock area. I divide the patients kind of into two groups. There's maybe a younger group who has good quality skin, good elasticity, and they just want to increase the firmness and the roundness of their buttock. Then there's a group who is maybe a little older and has more laxity of the skin, and we lean a little more towards procedures which are lifting the buttock and also maybe adding some volume in a couple different ways as well. The Brazilian butt lift, which is the classical procedure you hear most about, is a combination where, number one, you're reducing fat in the periphery of the buttock area to recontour the area, and then you can save that fat and reconcentrate it in a special way, and then reintroduce and re-inject it into the central buttock area to augment and lift and round out and fill out the buttock. It's a nice procedure. It's done as an outpatient and minimal incisions and a pretty easy recovery because it's minimally invasive.
What are some of the characteristics of the second group?
The other group of patients has more laxity in their buttock, and it's a much bigger procedure. It involves larger incisions, but is very effective in improving the buttock. Instead of pushing the butt up like a Brazilian butt lift, you're actually pulling it up. So tissue is removed above the buttock area. It kind of extends around to the sides a little bit as well, so we can sometimes pull up the lateral thigh. And the tissue is introduced into a higher level, which is rounder and fuller.
What is an auto-augmentation?
In some patients, instead of just removing the upper buttock tissue, we can retain it as what's called a flap, and we can rotate that tissue down into the buttock. So as we pull the skin up over the top, we can introduce that tissue down lower to round out and fill out the buttock. I call that an auto-augmentation. I like these two procedures, the Brazilian butt lift and the auto-augmentation, because we're using only your own tissue. Very safe, complication rates are low, and satisfaction rates are very high.
What about implants in the buttocks?
You will hear about patients having buttock implants placed. It's not a procedure I'm really crazy about because the quality of implant we have available here in the United States doesn't really match that which is available in the rest of the world. And a lot of patients who have buttock implants don't really like the way it feels when they sit down. It's like you're sitting on some artificial thing inside, which brings me back to why I prefer natural auto-augmentation type procedures such as the Brazilian butt lift, where we are just reintroducing and re-injecting your own fat into the area, or less commonly the auto-augmentation where we are rotating tissue into the area. So you can think more about buttock augmentation. If you're interested, please come and see me. My name is Dr. Terry Murphy. I'm at Swedish Hospital here in Denver, Colorado.